Gastrointestinal disorders. NCLEX questions with answers and rationales 1 to 10. Remember to purse the video to test your ability.
Question 1. A client is prescribed omeprazole for persistent gastroesophageal reflux disease, GERD. After 1 week of therapy, the client reports that the heartburn has significantly decreased. What should the nurse interpret from this client statement? A. The client may be experiencing a placebo effect. B. The client may require a higher dose. C. The medication is effective. D. The medication needs to be discontinued. Correct answer, C. The medication is effective. Rationale: omeprazole is a proton pump inhibitor, PPI, that suppresses gastric acid secretion. A decrease in symptoms like heartburn indicates that the drug is working as intended. Effectiveness is evaluated by symptom relief. Question 2. A client is diagnosed with a Helicobacter pylori infection. The nurse should anticipate a prescription for which combination therapy to eradicate the infection. A. Amoxicillin, ibuprofen, omeprazole. B. Clarithromycin, amoxicillin, esomeprazole. C. Metronidazole, aspirin, pantoprazole. D. Ranitidine, tetracycline, famotidine. Correct answer, B. Clarithromycin, amoxicillin, esomeprazole. Rationale: triple therapy for H. pylori typically includes 2 antibiotics, such as clarithromycin and amoxicillin, and a PPI, such as esomeprazole, to eradicate the infection and reduce gastric acid, promoting healing of the gastric mucosa. Question 3. A nurse is reviewing the medical record of a client who is prescribed metoclopramide. Which condition would be a contraindication for administering this medication? A. Nausea. B. Gastrointestinal obstruction. C. Diabetic gastroparesis. D. Heartburn. Correct answer, B. Gastrointestinal obstruction. Rationale: metoclopramide stimulates gastric motility and is contraindicated in patients with GI obstruction, perforation, or hemorrhage because it may worsen the condition by increasing peristalsis. Question 4. A nurse is providing discharge instructions to a client prescribed cimetidine. Which statement made by the client indicates a need for further teaching? A. I will avoid smoking while taking this medication. B. I will take this medication with meals. C. I can take this medication at the same time as an antacid. D. I will notify the provider if I experience confusion. Correct answer, C. I can take this medication at the same time as an antacid. Rationale: antacids can reduce the absorption of cimetidine. They should be taken at least 1 hour before or after cimetidine. The client needs further education to avoid this drug interaction. Question 5. A client with hepatic encephalopathy is prescribed lactulose. What is the primary purpose of administering this medication? A. To relieve constipation. B. To increase protein absorption. C. To promote ammonia excretion. D. To decrease portal hypertension. Correct answer, C. To promote ammonia excretion. Rationale: lactulose lowers serum ammonia levels by trapping ammonia in the colon and facilitating its excretion. It is a key treatment in managing hepatic encephalopathy by reducing neurotoxic effects of ammonia. Question 6. A client with irritable bowel syndrome with diarrhea, IBS-D, is prescribed allosetron. The nurse teaches the client to monitor for which serious adverse effect: A. Hypertension. B. Ischemic colitis. C. Tinnitus. D. Hyperglycemia. Correct answer, B. Ischemic colitis. Rationale: allosetron is associated with serious gastrointestinal side effects, including ischemic colitis. Patients should be instructed to report signs such as abdominal pain, rectal bleeding, or bloody diarrhea immediately. Question 7. A client with osteoarthritis is prescribed misoprostol in addition to naproxen. What is the primary reason for prescribing misoprostol? A. To improve analgesic absorption. B. To increase bone density. C. To prevent NSAID-induced ulcers. D. To reduce inflammation. Correct answer, C. To prevent NSAID-induced ulcers. Rationale: Misoprostol is a prostaglandin analog that protects the gastric mucosa by increasing bicarbonate and mucus production. It is often prescribed to prevent gastric ulcers in clients who require long-term NSAID therapy. Question 8. A nurse is educating a client prescribed sucralfate for a duodenal ulcer. Which instruction is appropriate regarding how to take the medication? A. Take the medication after meals and at bedtime. B. Take with a glass of milk. C. Take 1 hour before meals and at bedtime. D. Take with antacids for increased effect. Correct answer C. Take 1 hour before meals and at bedtime. Rationale. Sucralfate forms a protective barrier over ulcers. For optimal effect, it must be taken on an empty stomach, specifically 1 hour before meals and at bedtime. It should not be taken with antacids, which interfere with binding. Question 9. A nurse is caring for a client with a suspected bowel obstruction. Which type of laxative should be avoided in this situation? A. Stool softeners. B. Osmotic laxatives. C. Bulk-forming laxatives. D. Lubricant laxatives. C. Bulk-forming laxatives. Rationale. Bulk-forming laxatives increase stool volume and can worsen a bowel obstruction, potentially leading to bowel perforation. They are contraindicated in clients with known or suspected intestinal obstruction. Question 10. A nurse is evaluating the effectiveness of infliximab therapy in a client with Crohn's disease. Which finding indicates that the treatment is effective? A. Weight loss. B. Increased white blood cell count. C. Decreased frequency of diarrhea. D. Hyperactive bowel sounds. Correct answer. C. Decreased frequency of diarrhea. Rationale. Infliximab is a TNF-alpha inhibitor that reduces inflammation associated with Crohn's disease. A therapeutic response is reflected in the improvement of symptoms, particularly a reduction in the frequency of diarrhea.
Let's know how many questions you answered correctly by dropping it in the comment section below. If you enjoy this, hit subscribe and like. It helps us make more videos like this for you. We love you.